Hundreds of Arizonans are dying every day from COVID-19, but the misery is being felt in communities of color at a higher rate. Much like the first peak in the summer, Latinos in Arizona are being hit particularly hard. Investigator Liliana Soto and ABC 15 data analyst Garrett Archer break down the latest statistics.
The Hispanic community at the end of December had about 380 deaths at the last week in December. Now, 154 of those deaths were COVID-19 deaths.
Garrett Archer is ABC 15's data analyst. He says having 40% of COVID-19 related deaths in one ethnic group and in 1 week is concerning.
It's incredible.
Too many people taken too soon. Ana Hernandez and Leslie Lopez know firsthand the pain of losing their loved one to COVID-19.
In April, we lost some family members due to COVID in Mexico. In June, I lost my husband. And just recently, 2 weeks ago, we lost my grandpa.
My dad got sick before Thanksgiving, and he passed away January 6th.
According to Mayo Clinic, 60,298 Latinos have died of COVID-19 nationally. So why are Latinos dying at a higher rate?
Just the disparity in access to healthy food.
In fact, the Latino community has been disproportionately affected during the pandemic. Areas with high Latino populations in our state have been facing a lack of access to medical care or bilingual information about the virus, long hours to get tested, having almost no interpreters at vaccination sites. They're also suffering from a digital divide. Many don't have the option to work from home, and for some, the vaccine is out of reach.
I think it just really exposed the imbalance of our people.
There's also mistrust.
I know there's still a lot of people that don't believe in it. They say, oh, it's just like the flu still.
But COVID-19 is nothing like the flu.
There's been flu outbreaks, 2008, 2010. But I never would have thought it would have been to this volume.
Azar Dabdu is a funeral worker. He says in 20 years, this is the first time he's seen so many Latinos dying so quickly.
How many trips do you usually make to Phoenix?
Before it was once a week, and now it's 2 or 3 times a week.
He transports Latino immigrants who died of COVID-19 related issues. He takes them from Phoenix hospitals to his funeral home in Tucson, then to their families in their home countries.
A lot of families feel hopeless because they're in Mexico or they're in Central America, and unfortunately they don't have any other family here.
He says it's a sad situation, tragedies that could have been prevented.
It's very important for everybody to keep washing their hands and get tested as frequent as possible.
According to Mayo Clinic, we need 70% of the U.S. population vaccinated in order to reach herd immunity. But lack of access to information in their language is leading some Latinos to not want to get vaccinated.
A mí sí me da mucho miedo y yo no me quiero arriesgar todavía.
Until the vaccine, everybody has taken the vaccine, then everybody's at risk still to end up at a hospital or to end up at a funeral home.
Liliana Soto, ABC 15, Arizona.